Most people think stomach cancer is rare and will only come with a lot of pain and serious symptoms. What if I told you that there are 5 early signs a lot of people completely miss? And unfortunately, in some people, it can cost their life. We are going to specifically look at how to recognize these early signs so that you can be aware, be vigilant, and can take steps. Don't worry about it. In this video, we are going to specifically look at how to recognize these early signs. I'm Dr. Yoganand Reddy. I am a UK trained gastroenterologist. Please subscribe to this educational channel for more fact-based digestive health videos. So this is all about gastroenterology. No cancer is good, but stomach cancers can be often very aggressive. And so many times in my own gastroenterology practice, I see patients coming in at a late stage where we are unfortunately not able to cure the disease. So we really may need to be aware that some of these symptoms, firstly, that one should not dismiss and brush it off. Step by step, I'll go through a few things, what you can do to spot. Firstly, the first sign, persistent burning sensation, indigestion. So taking antacids, syrups, tablets from over the counter, dismissing that this is a common gastric issue, common indigestion because of some heavy food, oily, spicy, masala-rich foods or outside food. It is so common. If this happens occasionally, or if it has just happened a few days, and there is no harm, of course, in taking simple remedies if it is a short duration of symptoms. But you need to be more cautious if your symptoms of this burning sensation, persisting upper abdominal discomfort, indigestion, that is lasting for weeks together, going on into months, and it is not responding to the simple medicines or home remedies you're taking. This can almost be a sign of early gastric cancer, because gastric cancer symptoms can resemble some of that of like simple acidity, gastritis. So if you're experiencing frequent burning sensation in the abdomen, uneasy feeling, uncomfortable feeling, you should not be ignoring this. Secondly, feeling full quickly, what we call as early satiety. So that means that, let us say, if you're eating 3 chapatis for your dinner, but if you start taking only 1.5 chapati and you start to feel full, you don't want to eat anymore because it is making you feel uncomfortable, it is making you feel heavy, which means that this fullness that is happening repeatedly is not good, because gastric cancer, stomach cancer that is already there might be getting big in size. So the size of the tumor itself is causing, now limiting the stomach's capacity to hold more food, can cause irritation, inflammation, and also can affect how the stomach muscles are contracting. So the food and liquid can sit there for longer. So it can interfere with your normal digestive process. As the food and liquid can sit there for long, naturally on top of it, if you're eating small amount of food, then that will start to give you that very full feeling, very uncomfortable feeling. So this is a symptom that is very important, especially if it is repeatedly happening and going on for weeks. You should definitely not ignore this. Thirdly, unexplained weight loss, which means that you're not actually trying to lose weight, but the weight starts to drop. Slight fluctuation in the weight we all see happening, half 1 kilo here and there, depending on the weighing scales and also what time of the day you might be checking your weight. But if you are noticing that there is significant ongoing weight loss, if somebody else is noticing, saying that you seem to be losing a lot of weight, or on the scales you're checking and your weight is dropping, this is clearly an alarm sign of gastric cancer. Weight loss can happen because of combination of factors, which includes the cancer itself is worsening, it's growing, so its impact on the body. It also results in reduced appetite, so you don't feel hungry, you don't want to taste the food, you just get that aversion to food. So slowly you start to feel full with even eating small amounts. And naturally, if you're not going to eat much, the body will suffer, it can't get the right nutrition. And the digestive process itself can also be affected because there is a delay in the way the stomach is emptying food. So there are a variety of reasons why you might start to lose weight once the stomach cancer sets in. Fourthly, nausea, persistently feeling nauseous, feeling pukish, that vomiting sensation, or sometimes intermittently vomiting. Occasional nausea anybody can get, it's not something we should be worried about. But as the stomach cancer grows, the tumor grows, it can start increasing in the size. So it can start affecting how your stomach empties and pushes the liquid and the food. So large amount of liquid is just going to sit there, and that gives you that nausea feeling, not wanting to eat, and sometimes you are kind of forcing yourself to vomit it out. In some people, the tumor, as it is growing, the cancer, it starts to cause blockage. So the food and even liquid sometimes cannot leave the stomach. So as it starts accumulating, you'll end up starts vomiting. Lastly, you might experience black motions. So blood, internal bleeding from the stomach that gets digested through the small intestine comes out as black motion, as if it's like a tar on the road. So that kind of a color. So in this particular patient, you can see sometimes the blood count going very low, the hemoglobin is going down gradually. Sometimes the bleeding is intermittent, so it's not very obvious. So you might start to feel weak, and when you check the blood count, it might be very low. So these are the 5 early signs that we should not miss, especially in someone who is having persistent symptoms. So symptoms that are repetitively occurring over weeks to months. And lastly, abdominal pain. A lot of people think that if I don't have abdominal pain, I can't have stomach cancer. Abdominal pain tends to come later part of the gastric cancer. It's not usually an early sign. So that's why I not specifically mentioned this in the beginning. So persistent pain related to the stomach cancer quite often is a symptom of advanced gastric cancer. So just because you don't have much in the way of severe pain, it doesn't mean that there is no gastric cancer. So it's important to watch out the symptoms that I have mentioned. Also, if you have any kind of doubt, if you're unsure, or if you think that could this just be simple gastritis, could this be just a sign of an ulcer, could this be something more? If you have any such doubt, you should never delay it, just because by consulting and taking a simple opinion from a medical gastroenterologist might all that you might be needing. And sometimes you might require some simple tests to help resolve the doubt, because if we can spot the disease early, we can provide the right treatment so that we don't give the disease, the cancer, to take over your life. Thank you.